and welcome to a very special program where we discuss on the topic kids and diabetes in school, where we talk about diabetes, the disease, the myth, and why should we talk about it right at the school level. This is the CSR initiative of Conexus Foundation supported by Sanofi India in association with the Department of Health, Government of Goa. Kids and Diabetes in School by the International Diabetes Federation is a social impact initiative to foster a school environment that creates better understanding of diabetes and support children and with this condition. Let's start with some statistics. Diabetes is one of the fastest growing global health emergencies in the 21st century and is rising at an alarming rate. The International Diabetes Federation says almost 1 in 2 adults with diabetes is unaware that they have the condition. Well, that's very, very scary. Well, let's all be better informed about diabetes, and who better to chat with than our expert panelist. Joining me in the studio is Dr. Rajesh Javherani, Senior Consultant Internal Medicine and Critical Care at Margao, with 2 decades of experience and special interest in and expertise in diabetes. Also joining him in the studio is Mhalsakant Deshpande, Headmaster of Shree Mahalasa Narayani School, Verna. Gentlemen, welcome to the show.
Thank you so much.
Just to start the ball rolling, I really understand that diabetes is something that is related to sweet. It's a sweeter disease, if I may say so. But then again, there are a lot of consequences that follow. If I may say that there was one gentleman that I met recently, and we were having this conversation. And he all of a sudden, when we were eating a little sweet, he asked me, what is your age? He asked my colleague what is his age, and he was like a fortune teller for us, saying that you will get diabetes at this particular age or in the next couple of years. I think that is what diabetes is all about for us. I think every individual is battling, knowingly or unknowingly, diabetes.
So let me start by saying that diabetes is nothing but as simple as having high blood glucose levels. Now we have a hormone in the body called insulin, which is made by pancreas. And this insulin helps the body to utilize the glucose. Due to certain reasons, this insulin sometimes doesn't work properly. So which results in type 2 diabetes. So we have 2 types of diabetes, type 1 and type 2. The alarming rate of increase of diabetes type 2. And I remember 25 years back when I was a medical student, we used to see diabetes at the age of 60, 70.
Very true.
Today we are seeing at the age of 20. And not only that, I have been seeing type 2 diabetes even in children. In fact, I would like to just give an example. One 15-year-old boy, he's obese. He has some dark pigmentation on the neck, which is called acanthosis nigricans. So mother was slightly worried why it is so. My son is so fair, but why is his skin so dark? And we happened to check his sugars and he had diabetes. So this kind of a pigmentation can also be a marker of type 2 diabetes, or we call it as insulin resistance. And as we know, it's a silent disease. If we do not treat it, it can later on lead to complications, damage to the organs like the eyes, the heart, the kidneys, and the feet. It's so very important to control diabetes, screen for complications, educate the people what is diabetes all about. I mean, that's how we should be going through.
I think on that note, I want to focus on the academics part of it. Sir, you had a school in Verna. You talk to a lot of parents as well as the children. You meet them on a regular basis. I really want to understand is how are you looking forward to diabetes? So many younger kids are getting diabetes, and how do we go about?
Students who are facing with the diabetes, what happened? They have got fatigue. Due to that, they will not concentrate on the academic. Even peers looks differently to them. So that's why there must be not a solution only from health side or from clinical side. It should come in the school. The objectives of the KiDS program is to tackle diabetes related stagnation, support children with type 1 diabetes to manage their conditions in school, highlight preventable risk factor for type 2 diabetes, and promote healthier lifestyles to the younger audience. The program targets children's age group 10 to 15, that is from 5th standard to 10th standard students. And not only students, parents, teachers, even schools, the doctors are there. Now there is doctors who are looking towards the diabetes.
Correct.
They come to speak at the time of PTA meetings like that, so they can interact with the students, parents.
I really want to understand is the government or the policymaker is doing his or her job. the parents are doing and getting the
Yes.
best with respect to whatever facilities are required or the food, nutrition that is required. I really want to understand where is the problem area, whether it is the lifestyle that is the generation that is going through in the school, maybe the lifestyle has changed, or the kind of intake with respect to the food or maybe the environment. What is your per se, what is your analysis basically?
Yes, my analysis is now the students who are eating fast food, that is one of the reason I think. Behind this all the things. Why? Due to the fast food, and it is very easily available nowadays.
Correct. And also the lifestyle that
yes, also the lifestyle.
Whether it is you're having the screen time,
More screen time is there. After pandemic, what happened? At the time of pandemic, the screen time was increased, and now also what happened? Due to the after pandemic, now online classes, all that things are increased.
That has been consistent, but for all the wrong reasons.
Yes, correct. Yes.
not good reasons, I would say. Doctor, lifestyle, food intake, and the challenges that the teachers and the faculty are facing at the school level. Having been understood that is the new normal that we are, whether it is increase in screen time, whether it is the fast food culture, or whether it is snacks or whatever that we junk food that you end up eating. What are the signs and symptoms that somebody should be looking forward in order to, whether he or she is a parent or maybe from the school faculty, in order to understand and maybe take care of the necessary steps to go ahead?
Yeah. So I would put it like this: 9 out of 10 patients with diabetes do not have symptoms. Their diabetes is diagnosed accidentally if they come for a health check, or they happen to come to hospital with some other health problems. Or if they have a family history of diabetes, then they need to get him screened. Suppose if your one parent is having diabetes, you have 30 to 40% chance of getting type 2 diabetes.
Okay.
If you're both parents, then almost 70 to 80% chance of getting type 2 diabetes. So family history is very important. So suppose if in our family somebody has type 2 diabetes, it's important to get ourselves screened. In some patients who have symptoms, the symptoms are for excessive urine, excessive hunger, excessive thirst, weight loss. Somebody comes with weight loss can also be a reason why, the type 2 diabetes would present as. So, but then all said and done, it's a silent disease. So that's why screening, that's why it said that so many patients must be having diabetes, but they don't know that they have diabetes.
Correct. Very true. Is also another thing is you mentioned that if one parent has diabetes, there are 20-30% possibility.
Yeah.
If both the parents are having it,
Yeah.
it is 70%
Double
possibility. I really want to understand is in a family that is aware that now watching the program, somebody is aware that it's a wake up call for me.
Yes.
What is the age group that the child will start reflecting diabetes, or is it as the case may be?
So it is like this. In children, generally, you have more commonly type 1 diabetes. Type 1 diabetes generally does not have a family history. Okay. Type 1 diabetes generally starts presenting at the age of 6 to 8 years.
Okay.
And they suddenly land up in a hospital with high blood glucose levels. And they may have an acidotic breathing, they must be breathless. But as I said, now even in young children like 15 years, 16 years, we are seeing type 2 diabetes. And they are the obese children.
Okay.
Type 1 children are always slim and thin, but type 2 are the one who have obese. So that's why we are focusing in this KiDS program to reduce the incidence of obesity in children.
Because that's the obvious cause.
That's the obvious cause.
Okay, fair enough. Sir, I really want to come back to you is, there are a lot of things that, the schools discuss now. It's not just academics. And I still remember going back to my, schooling days, or maybe your schooling days, things were very, very different. Now it is quite open. A lot of things that are discussed. It is not only academics, as I rightly mentioned. It is also, your mental health is something that has been discussed. And it's very nice to see, especially in the state like Goa. When you have these kind of symptoms been discussed, does it encourage a child to take care of himself so that we can overcome this at a very initial stages?
Yes, it is possible actually. The schools can do the awareness by they can see nowadays there is ambassadors. We call as ambassadors. So like that, suppose the school decide that one student is ambassador of what? This program. So like that awareness can be created. And see, when students become the ambassador, awareness become a movement.
Correct.
It is not related to that students only. It will percolate to the full society also sometimes, and it will go to the school. And the knowledge is also required. What happened? Most of the times knowledge is very less. Means at that age, suppose that knowledge is given to what about the diabetes, what it is type 1 diabetes, type 2 diabetes. If you explain to the students, they will, and it should not be one time program. It should be continuous program. Now suppose one time you have taken that program, then we stop. It will not help. So it should be a continuous program. Then only it will help that level.
Also, another thing, sir, is you said knowledge sessions are required. I really want to understand is today's generation, which is there in the school, are really interested in terms of knowledge session, or the maybe policymakers or the organization like this federation or maybe Sanofi India or all these people who are pushing forward towards this agenda should also think out of the box.
I think they should also think out of box.
Okay, so that it appeals the generation that we are catering
appeal the
to.
generation.
You agree to it, sir?
Absolutely.
Okay. Also, we were discussing in terms of symptoms. You said it is a silent,
Yes.
so it's very difficult to find out the symptoms. What happens if it is unchecked? There are various cases, as you said, 40% chances, 70% chances, or generic chances. What happens, and what is the timeline so that you can take corrective measures?
So I'll just give you an example. In our hospital scenario, we get a patient with a heart attack. He's around 40 years old. He's never checked himself before for his diabetes, hypertension, nothing. When he lands up to the hospital, we do his routine blood glucose level and we find that his sugars are high. And maybe this diabetes would have been 3 years before, 4 years before, 5 years before. We do not know. So the diabetes which is causing the heart attack is being diagnosed when the complication is already done. So which means we need to prevent these complications. So for that, screening is very, very important. Now if you ask me, by what age you should start screening? Very difficult to answer because today we find even 20 years, 25 years.
Correct.
But I think anybody plus 30 plus should get routinely checked himself at least once in 2 years to look for. And then there's a condition called pre-diabetes. So if you're diagnosed with pre-diabetes, then you need to check it more frequently to find out whether the pre-diabetes become diabetes or not.
Correct.
And if you are diagnosed with pre-diabetes, you can try to control your lifestyle and dietary habits and weight reduction and make your sugars normal and come down to normal sugar levels instead of progressing to diabetes.
What is the comeback percentage of coming back to normal?
So
At any different cases, on average, if you may.
we nowadays we say something called as reversal of diabetes.
Correct.
When we say reversal, it doesn't mean that the diabetes goes away.
Control.
You can control it, diet and exercise, but then you need to be consistent it lifelong. It's like what happens is you develop diabetes, it's a borderline, you lose your weight, you stop eating sugar, you do your exercise daily, your sugars come to normal. Then the person thinks that, okay, I'm done now, I don't have diabetes anymore. And then he gets back to the same lifestyle, the sugars come back again.
So I think you'll have to embrace the happy moments and do away with the sweets.
Absolutely.
which adds sweetness to our life. Sir, another question that I want to ask you is, how do you then counsel with respect to with respect to the school management part of the story?
The Director of Education or Government of Goa has provided the counselors to the schools. So with the help of that counseling, we can do the counseling of the students. If any problem, students face any type of problem, there is a counselors in the school.
Correct.
Weekly once, twice they come in the school.
Moving back, you said you can control diabetes, but obviously there are certain lifestyle changes you need to make, whether it is exercise, whether it is food, nutrition, all lot of things, and also medicine, predominantly. How do you see these changes with respect to a student encountering, because he or she is a young child growing up, and then with all the pressure, peer pressure as well as the academic pressure, you also have this pressure to outperform diabetes or maybe control diabetes.
So I think that's a very good question, and it's a very challenging task, especially when it comes to children suffering from diabetes. So if you have a type 1 diabetes, that patient or the child has to take insulin lifelong. Okay, so there goes a lot of counseling in terms of the parents being counseled about it.
Very true.
The teachers in the school need to be counseled how to take care of such children who have to carry insulin with them to the school. The teachers need to understand what complications the child can have while being in the school, like the sugars going low or high, or what kind of, how much insulin doses the child is taking.
Correct.
So there that education goes towards the school also. The parents also need to be counseled. So nowadays there are small groups who suffer from type 1 diabetes, and then they form a group and then they try to counsel each other, exchange their experiences, how to take insulin, how much dose of insulin, what kind of diet. You cannot expect a child to be completely leaving the normal diet and being on a diabetic diet.
That's not possible.
So there also the diet has to be balanced according to the child's requirement. You cannot ask him to completely go off the diet, and he has to enjoy his life also.
True.
So then the insulin dose also has to be adjusted, right? When it comes to type 2 diabetes, I think there the importance of losing weight, exercise daily, and having a proper diet is very, very important, so that you can get him off the medications, because he's too young to start with medications. He's got a long life to live.
Very true. Because there are a lot of adults who would find it difficult changing
Absolutely.
and maybe embracing this new lifestyle to control diabetes, not even do away with diabetes. So I think here we're dealing with the students and the kids who are very at their tender age, dealing with a lot of pressure, especially in this very competitive world. Sir, how are you getting your school prepped? And again, with your school, and also how should Goan schools, whether it is government, private schools, should embrace for this changeover? Maybe, as Sir rightly says, in next 5 years or to 10 years, this will be a new normal.
Correct.
And we'll have to have this kind of, just like we had a first aid kit, we would also want our faculties to know, or the team management to know, school management to know, how to take care of a child who is suffering from diabetes. How are you embracing this newer change?
See, there are so many activities going in the school. Okay, with the help of activities, we can do the awareness about diabetes. And in the school, what happen, every week there is one period called mass PE period is there. Still it is there. Huh?
Of course.
And during that period, there is a lot of exercise physical education teachers is taking. Due to that activities. And another is what, 1 day of a week. You can call that as what, sugar-free Friday, like that. You can include in the school. With the help of that also you can do the awareness. Means what happens nowadays, almost all the students are eating sweets.
Correct. I do.
Yes.
Let me volunteer.
Okay, it's the sweet. To control that, at least once in a week, we can do that. And what happens, even students can force the mother that at least one meal in 1 week can we prepare without sugar. Like that, what happens if the students insist that, then it will be good things.
I think this sugar-free, Sakhar-free Shukrawar is not just a challenge for the child not to have sugar, but also a challenge to the parents who are cooking,
correct,
not to have sugar in the
full day
cooking process.
Yes.
And that's quite a challenge. We spoke about the out-of-box approach. Do you think that this Sakhar-free Shukrawar kind of an initiative is an out-of-box thing, which should work and we have seen in the past that it is doing wonders, and maybe going ahead propagate more schools and more kids under this brand?
Yeah. So basically I think the whole program is about telling the parents and the children that try to reduce the sugar content in your diet. At least by once a week following it, you can still have a healthy diet, and which can incorporate in your regular daily meals also. So by just giving 1 day example in a week, can carry it forward for other days also, and let them also understand how important it is to cut down on the carbs and the sugar diet in their content in their diet, and so as to prevent obesity. So I think it's a very good initiative. At least once a week, if they try it out, they can even try on other days. Why not?
With 6,500 children participated in the Sakhar-free Shukrawar for over 4 seasons, 150,000 plus students engaged in step club activities over the years in Goa, I think we can certainly say that it is a success of this program that we see all these years. Dr. Rajesh ji and Mhalsakant ji, thank you very much for joining me in this studio and having this wonderful discussion, sharing your insight basically, so that the students watching and also the parents embrace for this particular thing that we are facing, that is the sweeter devil or the evil that is there in store. I think it has been a very informative session with you, interacting on all such aspects. We look forward to be part of this similar conversation as we move. As you rightly said, sir, this knowledge session or the out-of-the-box thinking should not be one of a kind, but it has to be a consistent hammering on the narrative that has to be, or the agenda that has to be propagated to all the students and the faculties. Well, at the end of the show, I request all the parents to ask their children to check with the school on registering for Sakhar Free Shukrawar 2025.